In general, we are looking for healthy volunteers between the ages of 18 and 55 who also have a healthy weight. Of course, we will consider adults older than 55 or with a healthy weight on a case-by-case basis depending on their overall health. Liver donors must also be in good physical and mental health without evidence of active infections or cancers. While many liver donors are related or have a close friendship with their recipients, it is not mandated here at MGB. Importantly, the donor and recipient must have compatible blood types. For example, blood type O is considered the universal donor and could donate a portion of their liver to a recipient in need. To discuss your specific questions, you can always call our office at 617-643-5202 or email us at mghliving-liverdonors@partners.org.
Liver donors must be in good physical and mental health in order to donate a portion of their liver. Donors need to stop drinking alcohol and stop smoking before the operation, and shouldn't drink or smoke for an additional 6 months afterward. Donors can usually start light exercise within a month or two after the surgery and can return to their normal activities within a few months.
The recipient's health insurance will cover the donor's medical expenses. This includes the full donor evaluation, surgery, hospitalization, and visits during the recovery period. However, certain costs are not covered by insurance or the hospital, including travel, lodging, loss of income from time off of work, and other related expenses such as parking or child or pet care. Some donors may be eligible to apply for additional financial assistance provided by the National Living Donor Assistance Center, which is a federally funded program. This program may cover travel, lodging, meals, and incidental expenses incurred by the donor. Our team will help you determine if you are eligible to apply for these funds and assist you with the application process, if appropriate.
As with any major surgery, there are risks that are associated with the living donor liver transplant operation. Our donor safety is our top priority. The Mass General Brigham's liver transplant teams, through Living Donor Liver Transplant evaluation and testing process, helps to minimize the risk, as they are considered very carefully during the process in relation to the whole health of the donor. Our team works very hard to ensure the best possible outcome for the donors and the recipients. Most donors can return to their normal activity within only a few months after surgery. And throughout the evaluation process and prior to surgery, our team will discuss all of the possible risks with you and answer any question that you may have about the safety of the procedure. Naturally, the liver has a right lobe and a left lobe, and during the living donor liver surgery, we split the liver into two independently functioning lobes, either the right lobe or the left lobe of the liver, depending on which lobe is more appropriate for the surgery for the recipient, is removed and transplanted into the recipient whose own liver is no longer working properly. The living donor remaining lobe will regrow to its full size, volume, and capacity within only a short period of time, maybe about 6 to 8 weeks. And at the same time, the portion of the liver that was transplanted into the recipient also grows and restores normal, healthy liver function for the recipient.
Following liver donation, our care team will monitor you closely to ensure that you are healing and recovering well. You can expect to be discharged from the hospital after you have returned to eating and walking without difficulty. Once you've returned home, you will continue to receive follow-up care from our Living Liver Donor team, which will include blood work and clinic visits. For those traveling from out of state or the country, you will be required to stay locally after the surgery for at least 4 weeks. Most donors report some fatigue in the first few weeks while recovering.
There are several steps within the donation process, including the evaluation, surgery with the hospital stay, and finally the recovery period. The evaluation process takes approximately 2 weeks and requires 3 in-person visits here at the Transplant Center at Mass General or one of our satellite locations. It can be completed in 1 week or over several weeks depending upon the donor's availability and schedule. The surgery is scheduled at the convenience of both the donor and the recipient. Following surgery, donors stay in the hospital for about 5 to 7 days to recover under the care of our transplant team. After discharge from the hospital, donors can expect a 1 to 3 month recovery period.
Yes, the liver has an amazing ability to regenerate or regrow. After donation, your liver almost immediately starts to grow back and reaches about 80% of its original size a couple months after donation. Liver function actually comes back sooner. Your liver functions as a filter for the body, helping to remove toxins from the blood. It's also a factory, making and storing a lot of important components. These functions return to normal about 2 to 4 weeks after the operation.